Welcome to Narberth Family Medicine. My name is Dr. Andrew Lipton. This is Marianne Setterbrito. This is Narberth Family Medicine. We practice alternative holistic medicine. I'm a family doctor or an osteopathic doctor. We offer natural options for any health challenge. Marianne is a certified acupuncturist, herbologist, a hypnotherapist, and strategic coach. And we, over the past a few months, have done our research on medical marijuana, THC, and CBD, and we've gathered a lot of information and want to deliver it to you today. Marianne.
Thank you. So, who here has had a day that has just flown beautifully, where everything seemed to magically just fall into place? Okay, thank you. Thank you. Now, who's had a day that they would never want to live through again? Thank you. Me too. So that is one of the big reasons why Dr. Lipton and I want to share this information with you. I feel that this is something that can really help make a difference between those 2 days. This botanical substance has the potential to increase your ability to cope and deal with stress. So I've been practicing plant-based medicine since the late 80s, and I've been studying CBD for over 2 years now. And even in the past 2 years, there have been such huge changes and developments in the landscape and the research. Most of the research is coming from people who are taking it and then reporting back to us what their experiences are. If I have to sum up what CBD is, I would classify it as a superfood and an adaptogen. And what I mean by an adaptogen is it makes us better able to deal with stress. We have a process in our body called the HPA axis, which is the hippocampus, pituitary, and adrenal. And all three of those play a role when we get stressed. Now, who here has heard of something called the fight or flight response? Okay, now more than ever in our culture, we are unfortunately living in that space. That part of our physiology was put there for when we were getting chased by a lion, or when we were chasing our food. Now we are going into that mode. Those chemicals are getting released in our body at an ever-increasing rate. We also are seeing a phenomenal amount of inflammation and pain. And unfortunately, I'm sure everybody here has heard of the epidemic involving the use of opioid drugs. And I heard a really frightening statistic that it's about every 20 to 30 minutes someone is dying as a result of opioid drugs. So that's the other reason I'm passionate about this subject tonight, because it has the potential to save lives. I know that it has already saved lives. It has the potential to really turn that whole epidemic around. So that's why I think this is so important. The other thing is there's so much misinformation and myths out there around this. We kind of all grew up in an era where this was a prohibited substance. And so there's a lot of mystique and myth surrounding it. And I'm also here to help dispel a lot of that and get the best information I could get my hands on to you guys this evening. So I want to talk a little bit about the distinctions of what's out there and some of the vocabulary and words that are used to describe it. So we have a species of plant, and the name of the species of plant is Cannabis sativa. And within that species, we have two varieties that we're going to speak about tonight. One variety is marijuana. The second variety is agricultural or industrial hemp. Does anybody here know the difference between the two? One gets you high, the other does not. The one that does not, the agricultural or industrial hemp, the definition is that it has to be 0.3% THC or less at harvest. 0.3% THC or less. When they test the crop, if the THC level comes in higher than that, the entire crop is destroyed, and you have a very upset hemp farmer. So as a result, anybody that is growing recreational marijuana, or marijuana, meaning it has a high level of THC, the THC is what they call the psychoactive component. That is the component of the plant that alters the brain and how you think and how you perceive things. So these farmers do not want to be anywhere near each other because it could cost them dearly. If there is a marijuana crop too close to an agricultural or industrial hemp crop, the way the breezes blow and pollination works, the agricultural hemp farmer could end up with a crop that's THC level is above 0.3%, and vice versa. The farmer that is cultivating cannabis deliberately to get a high THC content is going to be upset because the agricultural hemp will have lowered the THC content. So what I have found is that this agricultural industrial hemp, in addition to what we're here to talk about, also provides some really amazing fiber that is used for protein drinks, soaps. You can make shoes out of this plant that supposedly will last 50 years. It's a very durable material that comes from this agricultural or industrial hemp. The other thing that we're here to talk about that comes from it is CBD. So when you break down the plant, the cannabis sativa, you have three main categories of ingredients. You have delta-9 tetrahydrocannabinoid, THC, much easier to say THC. You have CBD, and then you have another group of phytochemicals that they just kind of group them together and call them terpenoids. So within the realm of CBD, you have this oil that has 0.3% THC or less at harvest. If you are consuming it raw, that is what you'll be getting. If they're extracting that, they're going to get more milligrams of CBD in a smaller volume, and sometimes the THC will remain in there. So there's a school of thought, they call it the entourage effect, that says that they like to see all of the plant chemicals together. And then there's another school of thought called the isolate, where the CBD is isolated and there is no THC in it at all. So those are the two, within CBD, those are the two main categories. So what happens when we have the presence of THC? Well, that's when we get into Dr. Lipton's arena, and that is the medical marijuana. And so he's going to talk about what he's gone through. And again, I know Facebook, hi Facebook, you're watching this from all over the world. We're speaking from Pennsylvania in the United States, so we are specifically speaking about the culture here in Pennsylvania. So Dr. Lipton had to go through a specific process, and we did finally get medical marijuana laws passed, but there is a very rigid kind of set of steps that one has to go through, and he's going to talk about that.
So marijuana's been around for a long time. It's been demonized from the 1920s and forward, and as of the last decade or so, they're finding medical benefits. What's interesting is that the research is showing that our nervous system and neurotransmitter system actually has an endocannabinoid system, a system of neurotransmitters that's been there as long as humans been around, that is responsible for immune system, responsible for how we feel good about things, responsible for decreasing inflammation. It's the largest neurochemical system in the body, and it's only recently discovered. The endocannabinoid system, or the ECS, is one of the things that people relate to the runner's high. Okay, so we make it in our own body, and even though the federal government has made this drug illegal and THC illegal, there is a CBD receptor in the body, okay, and it's been there as long as humans have been there. So what's going to happen over time with other states legalizing it and making it medical and having colleges and universities is that we're going to have some more and more studies and information that lead to basically the scientific discovery of that we already know at this point, but then letting the FDA decide that this drug, which is listed as Schedule 1, means it's illicit and there's no medical benefit, and therefore it's illegal. And so there's issue with federal money. So all the states that sell marijuana or medical marijuana, they can't take credit cards because that's federal money. They have to do cash, and there's a lot of politics about it. After the last few years of going to conferences and hearing about medical marijuana and the CBD and the benefits, I started doing the research. Well, how could this benefit my patients? And Pennsylvania was in the process of doing this, and so when it was legalized, I researched it, and I was kind of disappointed. They call it medical marijuana because of the federal laws. Doctors cannot prescribe marijuana. So what all the states have done to get a loophole around the federal law, or what Pennsylvania's done, is they have made it that a doctor could recommend the use for potential clients who have specific serious medical conditions. So what that means is a doctor can recommend it, and you then the doctor certifies to the state that this patient is an appropriate one that could possibly benefit from it. And then the state, after their fee of a certificate, delivers a medical marijuana card. The patient then goes into a dispensary where there's no physician there. There's a pharmacist there, and there's a nurse there, and there's somebody that then decides what your patient is going to get. So initially I was a little removed, saying, well, I don't want to take the care out of what I give patients and put it into somebody I don't know at a dispensary who's, in my mind, just selling something. So what has developed over the time, though, is that there's more and more information because of anecdotal people trying this, and I have patients asking me again and again, will this help me with my pain? Will this help me with my opioids? Will this help me get off drugs that I don't want to be on? And so I finally decided to take the certification, which was about 20 hours of continuing medical education, different courses, and the courses basically listed time again and again and again that the medical marijuana, the combination of THC and CBD, which in the plant naturally have antagonistic effects, have benefits with neurological conditions. Our bodies are run by our nerves, so what isn't run by a neurological condition? So we do actually have some handouts on what the Pennsylvania law states as a serious medical condition, we're going to hand this out for you. Neurological conditions, serious, okay, ALS, Lou Gehrig's disease, MS, multiple sclerosis, any neurodegenerative, but when someone has a nerve that's pinched, that's a neurodegenerative. When someone has a radiating pain, that's a neurodegenerative. Neuropathies, Parkinson's disease, and we have a list here for you, as well as how the state requires registration for medical marijuana and the process that we go through. So that's a handout, and we'll actually pass that out, and you can each take one for that information.
Yeah, I think it's really important to look at this list because just in like kind of social settings, when the law got passed, I was getting approached by people who were recreational, and they were like, oh great, now I can go see a doctor and I can get this card. And I'm like, no, you have to fit the criteria of one of these conditions. So it's nowhere near as easy, I think, as people initially thought when we got the law passed. And the other thing is that we have seen much success with the use of the CBD And that means that there is even a smaller number of people that I think benefit from the presence of the THC. That is the principal difference between the two. And because we have these CBD receptors in the body, I could make an argument that anyone that thinks they would be a candidate for medical marijuana should do a course of CBD therapy for a number of reasons. Our goal here is to help people get to a higher level of health the simplest, easiest, and least toxic way possible. There is a toxicity associated with THC. So that's the goal, is could the problem be solved without the THC? And if the answer then becomes no, it can't be, then what is the lowest amount of THC that would be necessary in that person's care? You know, when they go to the dispensary, what would be the lowest amount that would be utilized by their body without there being the downside? So the downside to THC, as I see it, is it is psychoactive. So it's not a good idea to be driving cars, operating heavy machineries, you know, that kind of disclaimer that we've all heard. The other piece that concerns me, we're seeing more and more challenges with memory, with younger and younger people, where people are reporting to us they're not as clear-headed as they want to be. They're not able to recall information as quickly and easily as they used to. THC is in opposition to that. And when Dr. Lipton used the word antagonist, I found that was like one of my magic moments when I was studying this, was that when I saw a list of THC and what it does, and I saw the list of CBD and what it does, that's where I got very in touch with this antagonistic relationship. So nature, this divine architect, is brilliant, and within this one plant are these two substances that are opposites. So THC can create paranoia and anxiety. CBD takes away anxiety and paranoia. THC makes it difficult to think and interferes with memory and cognition. CBD improves cognition and creates a clearer way of thinking. CBD balances out the appetite. THC can increase the appetite. We can use that to our advantage in specific situations where people are wasting away. When people get into a situation where they have no appetite, they have no interest in food, that is one of the instances where the medical marijuana really shines. Anything else you want to add?
Well, so end of life, terminal, people that are that disrupted by their pain or the use of opioids, again, is another way, because of the psychoactive part, that you can get people off of something that maybe is destructive in their life. Most of the benefit that I see as a nerve tonic and in the cannabidiol is in CBD, not in the THC. So there are some cases where the combination really does work well. What I found out from the dispensaries is that there is ratios, and they're listed on the products, the ratio of CBD to THC. Now, if there's no THC, it's an over-the-counter product. It's not prescription. If there's even greater than 1 or 2%, then it becomes a federally controlled illicit drug. And so this is how we differentiate between whether you can buy it at Walmart or online, or whether you need to go to the dispensary for this.
So the other thing I learned about CBD is it's what we call fat soluble, as opposed to something that's water soluble. So something that's water soluble leaves your system very quickly. Something that's fat soluble hangs out for a longer time. So one of the things that I needed to wrap my mind around is when using CBD, because it's fat soluble, you have to kind of keep laying it down day after day after day and allow it to build up in the tissues until you get to what I call your sweet spot. And what I have seen is huge variations. I've had men that are the size of refrigerators that their sweet spot is a milligram or two a day, and I have had petite, tiny little ladies who take 50 milligrams a day, and that's their sweet spot. So this is something that's independent of size. So what I usually recommend in terms of the how to use it is that I have a schedule that I have made up where you take a couple drops at night and then you build up over 14 days. Usually my experience is somewhere between day 5 and day 8, most people find their sweet spot. But this is something that does require some diligence on the part of the patient looking to use it. This does not fit the mold of any other kind of substance, with the exception of, Dr. Lipton and I, we do work with the hormonal system. So it really reminded me of that. It really was analogous to that we will have a patient who requires one, dose of a hormone, another patient entirely different. So it's about your body's, your autonomic nervous system, that whole HPA axis that I talked about earlier. It's about how your individual body metabolizes the CBD and finding what is that right dose for you. So usually over the course of 14 days, people find that dose. If they get to day 14 and they haven't found it yet, they come back in and see me, and I put them on a stronger version. So that is one of the ways that this is undesirable, would be to start at too high a dose. So if you start with this low dose and you gradually build it up, because it's fat soluble, you're allowing your body to get used to it and to metabolize it and kind of laying down the foundation. On top of that, it is very good for acute situations. So last week I was on the beach and my friend's son had a seizure. I happened to have my CBD isolate in my beach bag. It's like, don't leave home without it. He normally needs Ativan, and the Ativan calms him down, but it doesn't really stop the seizure. 3 doses of the CBD given about 30 seconds apart stopped the seizure. So that's an extreme example of an acute situation where you can take a dose of the CBD in the middle of the day. I've also had people that have had job interviews that take a dose before the interview. Public speaking, a dose before that. Getting stuck in the middle seat of an airplane, that's another great time to take a little bit of CBD. So
I want to add on that dosing it, that CBD is, the dosing is safe. There is no theoretical lethal dose.
there's no toxicity.
Okay? Versus if you go, what happens with the psychoactive part, the THC, when it's used effectively, it changes. There's a high. But there can be paranoia and psychosis, and there are issues of some people having adverse reactions. You could drink a whole bottle of CBD. The worst thing that'll happen is you'll feel sleepy and go to sleep. So very, very safe as a supplement.
Yeah. Yeah, I wanted to check in with Joey. Do we have any questions?
We have one question about CBD receptors, if they're specific. The receptors are specific for CBD. So maybe just clarify that.
Yes, that was something that was very fascinating. In the end of the 80s, they found what they labeled as CB1 receptors, and then in about 1994, researchers discovered another set that they named CB2 receptors. So we are wired to receive the nutrients from this plant. We have those receptors already in our bodies.
So in the marijuana plant, there's THC that we know of. There's these phytocannabinoids, okay, which there are literally 30 or 40 that they've discovered, but the ones CBD1 and CBD2 are the ones that have been studied, and THC are the main 3 that have been studied.
Is CBD good to take to sleep?
Yes, I still recommend that dosing protocol, the going over the 14 days and gradually increasing it, because I have found there are some people that take it an hour or 2 before bed and that works for them, but then I have found there's other people that need to take it first thing in the morning, and then it helps them sleep better at the end of the day. So that is one of these examples I have of how we really do need to just keep going with the schedule and seeing what works. So one theory is that they say it's a biphasic system. So we have the receptors in our body, and that there is a PM cycle for the receptors and an AM cycle for the receptors. And again, there is, at this point, I have no way of predicting which one of the two cycles or both might be needed to assist somebody. So that's why we use this schedule of having you start with one dose in the evening, and then after 2 days, a dose in the morning is added until you again find your sweet spot, until you feel like it's clicked in. Did you, or we have one more?
More question yet.
We're gonna finish with them and then we'll take care of it.
Medicare, is CBD, medical CBD and THC covered by Medicare?
At this point now.
No, so Medicare drug plans do not cover, again, it's federally illegal, so that's a Medicare plan. Now, the evaluation for the potential use that I could recommend, the possibility, that visit is covered by Medicare.
Can CBD be taken with other medications?
Yes. Yes, and we would need to look at what those other medications are and set it up, because well, one of the things that brings us great joy is when we've been able to help people reduce the amount of prescription medicine they take or eliminate it. So that's one of the things that CBD has this great potential, depending on what the medication is. It has the potential to eliminate the need for the other medicine.
So there's certain drugs that it does interact with, and anti-epileptic drugs, seizure drugs, the dose may have to be changed. There's a couple of medications that are contraindicated, so it's a case-by-case basis with that. But yeah, they're very rare contraindications or interactions with drugs.
You may have answered this, but I don't think you did. For seizures, if CBD doesn't seem to work, is it good to use a touch of THC?
If they've exhausted the CBD and they've gone to the highest level, and again, I would want them to do the schedule and see if they are catching both aspects of that biphasic system. If they're still having breakthrough seizures, then I would either use the CBD, like this story I just told, well, that was an acute situation. That person was not on CBD. And then see, after that's all exhausted, then yes, I would look to medical marijuana, again, looking at one that's high CBD, low THC.
And my comment on that would be that if somebody's having seizures, you still need to be on the medication, and there's the titration schedule to bring them up to prevent the seizures, and then there's dosing when an actual seizure happens to recover sooner or to lessen that response. We call it a post-ictal response after that patient had a seizure. Sometimes they're like zonked for a day or two, and so you can dose again at that point, kind of in crisis.
Yeah, and again, when you think of it as being the CBD being something that lowers all the stress hormones and gets you back to being yourself, a seizure is very, very stressful. So the CBD in, the story I told you last week, I watched this young man go from being in the throes of the seizure to being himself again, to smiling and interacting with us. And so it just took that stress and just, dropped the stress level down. So the seizure stopped.
There's some more questions if you want to answer them. So at what point or what dose is THC toxic?
Well, it has the potential to be toxic at any dose, but certainly the higher the dose, the more the potential is. And I know at high doses, there is research that says people have had like schizophrenic episodes.
So the toxicity is a psychoactive toxicity. So it doesn't necessarily harm the liver or the kidneys, which are the organs of detoxification. But there are cases where, sometimes people develop something called schizophrenia. They have a psychotic break. It's a typical age frame of in the low 20s or so, where teenagers are smoking marijuana and the paranoia makes them have this psychotic break at an earlier time. The thought is that these people would have ended up psychotic or schizophrenic anyway, but the marijuana prompted this. So the toxicity is a psychological toxicity, not a organ of liver or kidney toxicity.
Next we have, for chronic pain, how long should they be taking CBD/THC before trying to lower their opioid doses?
So that's a case-by-case basis. And as we titrate up, the very quickest would be the 2 weeks to get that dose. But usually what we find is that we get people controlled and then we start to titrate down their opioids.
Yeah, so as the CBD's coming up, it's the ideal scene anyway. As you're raising the level of CBD, you are simultaneously very gradually, we like to really gradually drop the doses down so that there isn't a kind of rebound effect and causing more stress to the body. But that's the nice part about the CBD not having toxicity. Pretty much everything we use it for, what it's replacing is a toxic pharmaceutical. So.
And you take personal choice.
We've applied. Okay.
We'll get back to you on that. Future Q&A.
Okay, I think that's.
All right. Thank you to
that's it.
Facebook.
Yay, thanks Facebook and Instagram.